begin, this is what I left off my last talk. How do we move forward towards sustainability? We have a huge knowledge of the evidence base of this, but as Einstein said, it's not really the lack of knowledge of the problem, it's lack of imagination. How can we reimagine the lives of the women that we work with without violence? How can we work towards this next step of sustainability and scaling up wings? And really what I want to go over is sort of a conceptual framework on how to implement wings. What are the organizational considerations that we need to think about? What are community level factors? What are policy factors? What is going to shape? What do we have to tweak in order and consider to think about how we continue implementing wings, how we think about settings when we scale it up? What is it going to take to make this move forward? So there is something called the Consolidated Framework for Implementation Research, CFAR, and it's based on many, many studies of implementation research, organizational research, that they've identified 5 main domains that really, first is the intervention itself, then there's the outer layer of the outer setting, like external policies and procedures, things like policing, stigma, structural factors. This is what we operate. But then there's also an inner setting of just the real organizational factors that affect the intervention itself and just the process. So this is, as I said before, it's a meta-theoretical that includes synthesis of theories, models, and frameworks that are related to dissemination, innovation, organizational change, and knowledge translation and research uptake. So let's go to this framework, and I'm going to try to break it down a little bit. If you look, what we're trying to do over here is really in the middle. This is wings. Right? We all know about the core elements of rings: raising awareness of gender-based violence, then doing screening and feedback on gender-based violence risks, increasing motivation to reduce gender-based violence risks using motivational interviewing, enhancing support from family or friends using the social network enhancement, doing safety planning, identifying safety goals and service needs, doing service referrals, and then doing HIV counseling, testing, and linkage to care. These are the core elements, and all the different models that we've used, these are the core elements of wings. And we really hope to make a difference on the primary outcomes of first just identifying all the different types of intimate partner violence and gender-based violence, increasing community awareness and advocacy to address gender-based violence, reducing all types of independent partner violence and gender-based violence, and then also, increasing HIV testing, reducing drug use, linkage to drug treatment, linkage to and retention in HIV treatment and ART adherence. So this is what we're hoping to do it. But in order to really implement this intervention, what is going to make the difference? And so in the outer setting, as I mentioned before, we have what's really important is this network of gender-based violence prevention resources, services. You all come from the different CBOs, the different donor foundations, people from government social protection. We need to somehow link. Police are a critical component of it. So the key is, how do we create this network of champions for wings? No one organization can do it individually without the kind of support. And then what are the external policy incentives to do this? And it's great to have this new anti-gender-based violence law in Kyrgyzstan. The UN has just, has this whole platform in Istanbul about anti-gender-based violence. UNODC has the need to really integrate gender-based violence. So the policies are there, but where is the programs to really meet the needs of those policies? So I think there is support there. Then we have the inner setting, as I mentioned, of the organization itself, and those are the structural characteristics, the physical space, the infrastructure, the communication within the agency, the whole sort of organizational climate, and the readiness for implementation. And then we have the staff level characteristics. What are their knowledges and beliefs about the intervention? It's like one thing that I'm very happy to see here, of all the different implementers saying they really believe in the intervention. that they know it works. They've seen the personal stories, they've seen the data, but even more the personal stories that they've witnessed in the change. So, and then it's about, the intervention itself. You know, what's the source, the evidence base, which we know is high. What's the advantage of doing wings in comparison to other types of gender-based violence interventions? How many gender-based violence interventions are really out there here? Can anybody name one? Let me know. But so usually it's like, what's the comparative advantage of wings versus the other alternatives? But if there are no other alternatives, then that's something. So then it's also about the adaptability, which means that how adaptable is wings to different contexts. And we've already discussed how it was adapted to Kyrgyzstan, to India. How do we adapt these core elements so that it's contextually appropriate if we wanted to do it with elderly, if we wanted to do it with young adolescent girls in rural Kyrgyzstan? What would that take? And we do have a systematic process for adapting it. What's the complexity of the intervention? It's pretty simple to do. It really is. It's emotionally very draining for the staff, but it is, you know, a packaged intervention that can be done in 2 sessions. There is actually a computerized tool that is even, you know, I think in some ways easier to implement, but there are pros and cons of it. Then what's the quality and the packaging? And we're really working hard, Daniel is really working hard to take all the lessons learned, make the tweaks to the intervention, come up with an implementation manual, have it packaged so that it can be rolled out. And that's really an important piece of it. And then we have to come down to a critical thing, and I was talking to a colleague over here about the cost. So we do need to kind of estimate the cost. What, if you want to take this and scale it up in a primary care center, or scale it up in a child welfare office here, or in the criminal justice, what are the cost considerations? We know that's a huge issue. So, so here again is the CFAR network, and what we can see here is the intersect. What we talked about, the intervention is here, and the adaptation, the core components, and you know, how it's adapted. But this is also shaped by what we said: the inner setting of the organization and the outer setting of policy. These are the key individuals involved, that network of people that's so important. And so it's the idea is, as we move through the intervention that's unadapted, we have this support, and also just looking at that whole process of implementation. And let me try to break it down a little bit more. So in terms of when we look at over here, what is the importance of, we really have to think about the participant needs of the key target populations that we're going after. What are their needs? What are their resources? And how do we do that? And it's really, as I mentioned, adapting wings to best meet the consumer needs and building a network of key stakeholders. So in that adaptation process, we want to identify the key stakeholders serving that population. And first and foremost, it should be members of those populations that can speak and advocate. So they should be front and center of the adaptation process, but then we also need service providers who are servicing them, government representatives, funders, donors that are involved. And then what we usually do is try to build them together as a network of people throughout the implementation process when we first adapt it. Do focus groups with the key target population. And so the other thing, as I mentioned before, is the extent to which the NGOs are linked to gender-based violence and HIV-related resources and agencies. So for wings to really work, often we need to be able to refer them to places. And we know that, you know, for women who use drugs, this has been a tremendous challenge. There aren't like emergency shelters for women who use drugs, and they're often not accepted. Even in the US, in New York, we have only one agency that will accept in all of New York City women who actively use drugs. So it's a real challenge to build those relationships, because part of the wings is that case management tool at the end where we're really trying to identify service needs and link them to services. And if they're not the services there, then we really have to develop those services and make people sensitized to the issues of women who use drugs. And we've done a lot of trainings with things like medical providers so that they're really sensitive to their issues. So that's important. And it's really important as we think of a community of providers that we have that program collaboration and service integration to avoid duplication of services. Unfortunately, there's a climate, and when there's funding sources are scarce, it's like this fierce competition for the same resource and duplication of services. So I think for this particular project, as donors, we really need to think about how we promote program collaboration and service integration. So the other piece is on the, as I mentioned before, the external policies, and I've already gone through the new anti-gender-based violence legislation, the improving police response, which I think the program that we did through WINGS to improve the police response was really helpful, and really identifying those champions within the police department who can respond appropriately and sensitively to the women who use drugs or experiencing violence. And same thing we needed also, very much so, in the hospitals, emergency departments, and medical care. Because a lot of the women are not seeking medical care because of the way they're treated. And so I think we also need to think about how do we train those providers to respond sensitively to it. And then I also think with UNODC that we really need to promote this idea of gender-based violence as a critical component, along with those 9 other components, in harm reduction services. Let me just go through the inner source. We've gone through this before. So WINGS, the evidence base is very strong. We've developed it from 2 randomized controlled trials, and we've also now have 2 other trials in Kyrgyzstan and India, pre and post tests, that all have shown positive results. We've used the same process. We have a really systematic process to adapting it now, which I think we can also put in our intervention manual. So it's also the stakeholders' belief of the evidence strength and quality, and so a lot of it is so that they're very familiar with the core components. And I think that's part of our job of those of us who've implemented it, to really educate people as to what the core components are and how it can be adapted to different populations and really mainstream. Can this be mainstreamed in primary care settings, emergency departments, police departments, because they are also picking up these cases. So we need to think about where this can be housed sustainably, in addition to all the NGOs that have been working on it. So then I mentioned the relative advantage, and then also the adaptability. I think we really need to clearly identify what intervention core elements shouldn't be changed. We really should try to keep all of them, but what are the adaptable characteristics so that we know that the evidence, it will still be evidence. And then, so what are the essential core components of WINGS? We think the ones that we've cited above are there, but sometimes you may want to shorten it. Maybe you don't want to go through all the components. And we should think about ways of shortening it for certain, maybe general populations, where we just do, screening and then, referral to services, which is the standard way that intimate partner violence is picked up in the States in healthcare settings. But I do think that the full set is more effective. So then I think we really have to think, and this is something as providers and as donors and coming from different key stakeholder positions, really how we best package WINGS, we market WINGS, and really for engaging, participants and things. So I think this next phase of taking all the lessons learned, tweaking it, the implementation lessons, and really coming up with products that people can, through the website that Dan was also going to be working, an implementation manual. But your feedback is going to be really important to that piece. So the other question is, how do we come up with a cost estimate for WINGS? And I think we need to kind of break down what the cost of, staff time is, infrastructure costs, space costs, those kinds of costs, which we can come up with a cost estimate. Cost effectiveness is a little hard to do with this kind of sample, but that would be a next phase of research that I would love to see done, because I think that is obviously a concern of any kind of policymakers or program developers that will want to take this up. And then it's also one of the considerations is for some settings maybe that computerized self-paced tool is going to be more cost effective. There is an upfront cost of developing the tool, but there is the long-term savings of staff training, staff over, and staff time in delivering it, and particularly in very busy settings like emergency departments or primary care, where people just don't have time. And so then, in terms of the other things for the inner setting is really the readiness for implementation and leadership engagement. And I have to say, this is a very committed group of leaders. I mean, we couldn't be luckier in terms of having that level, really, really high level of engagement of you folks here. So I'm confident knowing that I think we have a good chance of succeeding. Available resources. So what are the minimum resources for NGOs to implement WINGS? And we can talk about this more. What do we need to, in terms of participant incentives, in terms of referrals, in terms of staff incentives to do this? This is important to consider. What are the minimum levels to still make it effective? I think this is an ongoing question. And then, so the other thing is access to knowledge and information. So we also need for new implementers, and as well as ongoing people, is to really have that technical assistance website, which we're the level of training, ongoing technical assistance is really important. And one of the key pieces that we really want to keep on doing is collecting that data on intimate partner violence and gender-based violence among these key affected populations, as well as possibly moving towards the general populations of elderly, of adolescent girls. We don't know the rates of violence in these populations. And this is a tool that can do that, that can be really used for mobilizing communities and advocacy and policies to really sort of live up to the anti-gender-based violence legislation that is here. So I think that's important. And then structural characteristics, what is the impact of WINGS on physical space? We need a private space to do WINGS. It's not something that should be done in the open. And so that's a consideration to think of. India is now thinking of using a mobile van to do it, but we need to be creative sometimes also, because I know physical space is often, or private is often at a premium. And then it really, again, is enhancing networks and communications. So you all have champions within your agencies, experts. How can we continue to network all of you together moving forward? Because I think we need to support each other. Challenges that one group may face can be answered by another group. So whether it's listservs, ongoing mechanisms to keep you all linked, moving forward, I think is a very important thing that's found to be effective in scaling up interventions and sustaining interventions. And then in terms of the culture is, how does WINGS fit into the organizational climate and culture of, is it, and who are going to be the champions? And so I think the other considerations in the inner setting are also really thinking about, is it appropriate for all organizations? No, it's not. It really depends on, how important is addressing gender-based violence to the key mission and values of it. So we really need to think carefully about where this should be best housed, and how central is WINGS to the mission and values of the NGOs, and then how important is WINGS compared to the other organizational priorities. So you guys are all doing multitasking, doing many things, which have mandates to different funders, different organizational mandates. So I think it's important to think through how central is WINGS to that. And then it's also this thing of planning and really careful consideration of compensation for staff who are doing it and natural incentives that exist. Because it is hard work. It's 2 sessions, but the staff are exposed to hearing really, really awful stories of violence. Often there's something what we call vicarious trauma, which is secondhand. You hear it and these stories wake you up in the middle of the night. I've done these interventions and these stories last with you. So we need to take care of the staff who are doing it so they don't burn out. Because many times, so many of these women, it was the first time they ever told anybody about the violence. And so you're at the front lines of hearing it. So we need to take care of the staff. And so I think it's also how are WINGS goals integrated into the whole organizational goal processes and planning. So if it's sidelined and it's central, it's like just a project, the likelihood of it actually being, sustainable is not great. So the idea is, how can we really integrate wings into the central services of an organization? And so, and it's also how to promote a really positive learning environment for wings, that people and staff who are doing it together, learn together, staff from different agencies can share the experience. And so for the individuals implementing wings, what we really want to see with the staff is, what is the sort of core level of knowledge and skills of the staff to initiate and sustain implementing wings. And we know that it can be done by peer advocates as well as professionals, and the training typically takes, 2 days. I think with staff who are more professional, have more professional skills, we can do it in a day. I've done it in a day with staff who have training. And then it's also, how do we increase motivation of frontline staff to implement wings? How do we increase their confidence in being able to implement wings? It's scary to ask about violence and to address it. It's like a hot potato issue. So it's really making staff feel comfortable with that. And how does staff see their role in the organization, and how can implementing wings enhance their perception of their role in their professional development? So I think it's also just, again, in terms of the process that we're looking at, that really kind of throughout is just really the careful planning with all levels of the organization, the leadership, supervisors, front lines. We need to identify those champions and opinion leaders who can really promote wings in the organizations, in the community, and network them. And so these are also, and that's really like mapping everybody and thinking about what are the natural ways that you all sort of communicate and collaborate as people who are have this shared mission of fighting gender-based violence and fighting HIV and drug use. So, some of this, just boiling down to some of the key considerations is, we need to think about if we need to prioritize training and technical assistance, what time and priority should be given to wings in an organization, what's leadership commitment and champion of wings in an organization. These are the kinds of assessments that we need to think about. What are the network of gender-based violence services that we can pull together to support wings and referring people out? What is the toolkit for wings that we can really package and have a very dynamic toolkit? And then again, the big question, funding and resources, and that's a key issue moving forward. How can we think of different funding strategies? And as we move forward, I think these are some of the questions that I still have in mind that I really would like us to focus on in our discussions as we move forward today. Is what is the need for ongoing training, technical assistance, and supervision of staff? How to create and maintain a network of gender-based violence resources in the communities? How to continue collecting and analyzing data on incidence and prevalence of different types of gender-based violence and getting that feedback. How to mobilize key stakeholders and use data from wings to advance policies and programs to prevent gender-based violence, and how to identify and secure funding sources for wings. So that is kind of where I'm at. We have gotten to the initial stages of wings of taking off. We can either go down and crash, or we can soar. And so it's really about, we're at a critical juncture in terms of either going to soar or to crash and die, like a lot of pilot projects. And unfortunately, there's so many evidence-based interventions that they get through that pilot stage and they don't make it further. So I'm really hoping that wings can be one of those ones that soar. Thank you very much.